Hello, Marcus. Thank you for agreeing to do a video post for us. We've invited you on today to say something more about your upcoming event, Crisis in CAHMS Services. And to help our listeners, perhaps you could say a little about how you're defining the crisis, and then maybe go on to say what you think are some of the causes.
Well, I'm not a CAHMS worker, but I have been involved recently in seeing families and hearing about children and young adults who are struggling to make the transition from childhood to adulthood. It's been talked about a lot in mental health services and in the news that CAHMS services are struggling to cope with the number of referrals being made at the moment and the complexity of the referrals. Many kids are presenting with serious and complex problems, often quite risky behaviours. And the importance of CAHMS services is if families and kids don't get timely support, these problems can become more chronic and they carry forward into adulthood. And that's very problematic. So we need good functioning CAHMS services. And now, in terms of the contributing factors, I mean, we'll talk more and you'll hear from people who are on the front line on the day. The thing is that I've known that services are under pressure from a financial point of view due to austerity over the last 10 years. That means you're cutting posts, but you're also losing experience. And experience is extremely important when you're dealing with people who've got complex problems. So services are struggling to manage, and that's having an effect on the morale of these CAHMS services.
Right. And I guess that contributes to recruitment and retention of staff too.
Yeah. I mean, it'll be patchy throughout the country, but that is a problem, recruitment and retention.
Great. And so the idea of the event and its context, perhaps you could just say a bit more for those who are interested but are still unsure about what to expect.
Well, we've got people from different disciplines, psychiatrists, psychoanalysts, nurses, child psychotherapists, and they'll be talking from their experience of the front line, like what are the pressures that they're under? How do they understand them? So giving people a really good picture of what we mean by crisis. Then we'll talk a little bit about what we think might help. And then the panel will pause for a bit and the audience will be invited in to join in the discussion. We get a wide range of people attending, some people very knowledgeable who know in great detail what's going on in CAHMS services, other people who have just heard about the problem and are interested to hear more.
Right. And so the event, it's on Zoom?
It's on Zoom. It's free.
Right. Most important.
Yeah.
18th of July?
That's it. And what we want to do is give the audience an experience of us thinking, what has psychoanalytic thinking got to offer this area? Have we got a lens through which we can see things which might provide some sort of illumination as to how to manage, how to understand and these pressures and manage them better? We have an annual course which will start in September called Therapeutic Relationships, which we're wanting to interest people in.
Right. Okay. So it's part of that larger context too.
Yeah.
Well, that's terrific. I think we've run out of time this evening, but anybody else who is interested will be able to follow the link on the website. Many thanks, Marcus. Bye-bye.
Thank you, John.